honestly, the first time that I look at this beautiful lens was in an ECOS conference in Florence, in which you, Pablo, presented this kind of IOL. And honestly, as soon as they was available in Italy, I was really struggling to try this experience because the concept at the base is very, very strong. And I was very happy to start my little experience, but I will show you my honest cases. And I don't have still too much number to make statistic, but I want to show you the real life and the quality of this lens. So my experience with ArtIOLs actually is a small experience, 10 bilateral implants for the R25 and 10 bilateral implants for the ArtIOLs 40. And what I did is to analyze this patient, and I excluded the patient with more than 2 diopter of astigmatism because actually I do not have the toric version of this lens, but all the astigmatism up to 2 diopter was treated with a automated femtosecond laser incision, the arcuate incision. And then I focused on postoperative refraction, uncorrected and best corrected, and especially at aberration profile that I think that actually is the real show of quality of vision. I want to show this patient in which I implanted the ArtIOL 40 with a planned micro monovision left, and I left minus 0.5 in the right eye and pointed at the ametropia in the left eye. And I want to show how to implant this lens. The lens is very simple to implant. It's important to hydrate the lens because in this way it will slide very well in the cartridge. This is the solution that Voptica sent to you, is the Medicel injector. And in this way, it's just so many important to put the the rear optic under the plate. And in this way, after wetting the IOL, I will show you in advance. Okay, this is the injector. Honestly, I prefer to implant this lens in 2.4 wound. So in this way, I can see very well the lens. In this way, okay, I'm enlarging to 2.4 in this way, and then you release the lens. The lens is very soft, so in this way you can control very well, and also the optic is very soft, so you can easily reposition, and the quality of the lens is very beautiful. Is so smooth also to deliver, and is very safe. And I want to show you the results about aberrometry. So as you can see now, okay, as you can see, the quality of vision is very good. If you look at the Strel ratio, is like the quality of vision of a 20 years old patient, and also the profile of aberration is all in the green. So this is a sign of a quality of the lens. This is the left eye. In the left eye, there was some initial PCO, but I prefer just to do YAG laser after 1 month. But what really impressed to me is the focus curve. As you can see, I pointed at minus 0.5 in the right eye and the ametropia in the left eye. And if you do micro monovision with this lens, you will have a dramatically improve in the range of amplitude and without really compromising the quality of vision. And actually, my choice now when I implant RT40 IOL is to look at the micro vision. In this way, I have an amplitude that is comparable to a trifocal lens, but without the loss of quality as a lot of trifocal IL shows. This is the aberration profile. As you can see, is very, very smooth with a very smooth transition. And to me, the most important thing, if you look at the green, you have an area of homogeneity that is quite the same from the center to the periphery. And this is consistent with what Pablo said, that the quality of the lens is not still in the center, that is quite obvious for all the IOLs, but the quality of the lens is especially in the middle periphery. And this is the reason why the patient can see very well also in driving in the night. And if you can see the Strel test, for example, for this patient, is quite comparable to a monofocal IOL, but with a range of amplitude of a trifocal, especially if you do micro monovision. So to me, the best thing of this lens is really the quality of vision. I will show you another cases. In these cases, I implanted the lens with a conventional Monarch, and sorry for the sound. And okay, 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 okay. And as you can see, you can also implant easily with the Monarch if you're not confident with a Medicel injector. But the lens is very, very easy also to deliver with a Monarch system. But what the patient tell about this IOL? I do also a quality of vision questionnaire for this patient, and the patient have was very satisfied, especially for the halos, the glare, and the starbust. That they do not complain in most of 90% of the population of my little study. And this is so important because when you promise quality of vision and also depth of focus, sometimes the patient are very happy in the day, but in the night for conventional lenses, sometimes is a disaster. But in this patient, they have a quality of vision that is really comparable to monofocal IOLs. And what about the spectacle independence? So most of these patients, especially with the micro monovision, they can see very well also and near in more than 50% of the cases. And we are talking about a needle lens, a needle that provides a good intermediate view. But in these cases, using the micro monovision, also in more than 50% of the patient, they were very satisfied with the near, especially in also in mesopic condition. So honestly, this is the state of the art for overall quality of vision. And what about also the precise of calculation? Most all this patient was within 0.5 diopter for emmetropia. So also the calculation is very, very precise. So in conclusion, my early experience with ArtIOL 40 is that they provide an excellent visual acuity at all distance and a high spectacle independence, and really minimizing the photic phenomena. I did not have one patient with negative dysphotopsia, and as Walter showed, especially in hyperopic patient with the hydrofoil lens, the phenomenon of dysphotopsia is quite frequent. I do not have one patient in the hyperopic group that had one of these problems. And what it is important also for me, but especially for the patient, that we have a contrast sensitivity that is quite comparable to the best monofocal IOL. And the quality of vision referred by the patient is outstanding. Actually, my only issue is that I do not have the toric version, but Pablo said to me that it will be soon available. So actually, I'm managing my patient with a arcuate incision by femtosecond laser, but I think the toric version will be soon available. So I would like to thank you for inviting me in this beautiful webinar, and I'm sure that ArtIOLs has a great future.